Hi, welcome to my channel Nursing Concepts. Learn, understand, and apply. Today I wanted to tell you something, a story which many of us are familiar of, a story where actually the modern nursing has begun, a story that inspired many of the nursing students as well as the nurses, a story which changed the healthcare or a nursing. Nursing students get scared and confused at the beginning, and we are one among them. Nursing has a powerful story, and it did not just start with missions or hospitals or procedures. It has started with a very basic act, that is, care for the sick. Today, let me tell you a story of how truly a nursing began.
History of Nursing. The story that changed nursing. Nursing as a profession that existed throughout the history, although it evolved considerably over a period of time. We can see nursing in the olden days and in the present days. But if we compare the nursing in the olden days and in the present days, there has been a lot of improvement. There has been an update in the nursing. We can see a change in the nursing as the days are moving forward. And the term nursing has been derived from the Latin word nutire, which means circle. In a general term, we can say it as a field. This is primarily referred to a wet nurse, and later on it has evolved to a person who provides care in the later 16th century. The entry of a woman has been into a nursing care can be traced almost around 300 AD, but according to the Bible, it was mentioned way before. In the olden days or before the modern times, if a person gets sick, the care will be provided by the either family members or by any authorities' official orders or by an untrained people. But because of the poor hygienic environment or because of not following any standard principles or any precautions, the infections rate were high, which leading to a more number of deaths. Nursing has been called as the oldest of arts and the youngest of the professions. In those days, there was a woman who changed the nursing completely, and she is Florence Nightingale. She was born on May 12, 1820, at Florence, England, in a well educated and in a wealthy family. In those days, in the rich families, women were supposed to get married and manage home and lead a very comfortable life. But Florence Nightingale was different. She wanted to become a nurse because she believed that providing care for the sick is not a low job, but it is a meaningful responsibility. Even though her parents did not accept her to become a nurse because in those days nursing is considered as a dirty and uneducated work. But still, Florence Nightingale chose to become a nurse because she felt it was a calling from a God to serve. Nursing is a choice of service, not a convenience. So this is one point I wanted to mention in particular because many of our present day students, nursing students and many of our nurses, they are choosing nurse as a convenience where they can work and they can earn money and they can go abroad or they don't have any other choice. They have nothing other option, so they have chosen nursing. But keeping aside all the choices, nursing has to be chosen as a choice. It has to be chosen because if you have a passion to serve as a nurse, then you have to choose a nurse. Do not select nursing as a convenience. It has to be selected by choice. And the corner image that you can see here, it is the house of a Florence Nightingale. In those days, Crimean War was going on. In the Crimean War, many of the soldiers they were getting injured and they died. They were dying not because of the injuries. They were dying because of the improper hygienic environment and also because of not having a proper nutritionist food and because of the infections the people were dying. And to provide care for those patients, few nurses were sent to that place, among which Florence Nightingale was one. When she went and saw that area, she was shocked. She didn't start immediately with all the procedures, treatments, and all the any therapies or any other procedures. She started with a very basic care, that is cleaning the wards, providing proper ventilation, avoiding the overcrowding of hospital, and providing a nutritious food, providing a proper environment. So these are all the things she have done, which later decreased the death of her patients. Basic nursing can save lives. This is the point that I wanted to highlight here so that we can learn something from this point. So sometimes we think that nursing is all about the procedures, doing something this, that, and all. Before providing a procedures and all, it is the important thing, or it is the important responsibility of a nurse to provide a basic care, being it observing the patient or talking to the patient or even comforting the patient or providing a proper bedding, that is a bed making, or providing a good ventilation, making sure that your ward is clean, your unit is clean. So if the nursing students, especially if we remember our student nursing student life, we remember the importance of bed making and also unit cleaning, ward cleaning, right? So bed making, that is why bed making is very much important. So basic nursing care can save lives. So one night, Florence Nightingale, she went through the wards. Everything was quiet, and she was holding a lamp in her hand, and she started to observe patients one by one. And she went to them and provided care and talked to them and also comforted them. Even the patients who saw her, they felt safe and comforted. Are we the nurse who provides care and who provides comfort and safe feeling to the patients? If not, let us think ourselves. And this is the reason Florence Nightingale is called as the lady with the lamp. Nursing is not all about the procedures, it's about the presence and the observation also. Especially if we remember the nurses, especially the nurses who are working in the hospitals, when you go to the work, what are you doing? Are you just going and doing the care and being in a nurse's station all the time? Or are you going to the patients and talking and comforting and observing them? So this is one point I wanted to highlight here from this slide. So, not just the procedures, not just providing the treatment, it is our responsibility, it is a nurse's responsibility to go and talk to the patients, to observe them, to provide comfort for them, and to provide a safe feeling for them. And later on, after providing care for the patients and when the death rate has been decreased, Florence Nightingale, she believed that this care should not be a blind care, just going to the patient, providing some random care and coming back. So it is then she started to record all the data and also observe the patterns, and she used the statistics to prove that death rates can be decreased by providing a proper environment, by providing a good ventilation, by providing a nutritious food, and by observing the patients continuously. So nursing is thinking and reasoning, not memorizing. So this is the other point I wanted to highlight here. So especially the nursing students who are studying, so nursing is not all about the memorizing or by hearting the topics. So that is why I'm focusing more on the concepts. So concepts are more important so that you will start to think, you will start to reason for everything that you are doing. For example, bed making, don't, it's not like just going and doing a bed making. You should have a reason why you are doing a bed making. You should have a reason why you are doing a vital signs. You should have a reason why you are providing an injection. You should have a reason why you are providing care for a patient. So it's not by hatting, it's not memorizing. Nursing is about thinking and reasoning. So if you know the concepts, if you know the basics, if you are able to understand, then you can start to think and reason nursing. And when the war is over, Florence Nightingale, she started schools, nursing schools, and she wrote books. She wrote nursing principles, she wrote nursing standards, theories, and also she trained nurses to think, observe, and care patients. And the present days, whatever the things we are following, either hand hygiene or bed making or checking the vital signs, observing the patients, what are all the principles we are following? These principles are once believed by the Florence Nightingale. The same principles we are still continuing. So that is the reason Florence Nightingale is considered as the founder of modern nursing, because she started the nursing schools. So nursing began with care, observation, and responsibility, and that is where every good nurse begins. So here there is one more question. So it's up to you whether you wanted to become a good nurse or a nurse. So think yourself what you're doing. And today we study Florence Nightingale in books or in the classes or in through the online websites. But the real question is, who is the Florence Nightingale in the next generation? Maybe it's you who is watching. A question to yourself. What kind of a nurse do you want to become in the future if you are a nursing student? If you are a nurse, what kind of a nurse you are in? What are the improvements that you have to do?
If you ever feel nursing is difficult or the basics are boring, just remember this story. Let's start our journey with the nursing basics. Also, let me know in the comment section what one value or what one thing from the Florence Nightingale that you wanted to practice in your nursing life.